Dear friends, in the US, 1 in 2 men and 1 in 3 women are at risk of developing cancer. This is a very high risk that I had no idea about. On September 10th, 2012, I was diagnosed with cancer. September 9th, I was a healthy, vibrant woman. And September 10th, my future was uncertain. I lost my past and I forgot my future. Or rather, I forgot my past and lost my future. Whichever way you look at it, it was a very difficult day of reckoning. I urge each and every one of you to please go consult with your doctors to see how you can reduce your risk of cancer. Please consult your Western and Eastern doctors because cancer is not an easy illness to get or to cure. I love you all. Take care and good health. Thank you.
1 in 8 women will develop invasive breast cancer in their lifetime. In 2014, 40,000 women are expected to die of breast cancer. Early diagnosis is the key. Let us talk to our expert today, Dr. Hetal Verma. She's the Director of Breast Screening at Cambridge Health Alliance. Hetal, welcome to the show.
Thank
you for coming. So, tell us some of the risk factors for breast cancer.
So there are many different factors that are associated with the development of breast cancer. Some of the most prominent are things like personal history of breast cancer, a family history of breast cancer, or a genetic risk. Other things that can be associated with breast cancer are an increased number of menstrual cycles during the lifetime of a woman. So women who start menstruating at an early age or women who reach menopause at a later age have a larger number of menstrual cycles during their lifetime, and this has been associated with an increased risk for breast cancer. Sort of along the same lines is a woman who has not had a child or a woman who has a child after the age of 30. That has also been associated with the risk of breast cancer. Things that a lot of these things are not things that you can change. Right. There are certain factors that you are able to work on to help lower your risk of breast cancer, and this includes things like alcohol intake, obesity, lack of activity, smoking, correct. So all of these things are associated with a slightly increased risk of breast cancer, and these are all things that you can control and try to minimize.
How about tell us about the BRCA gene also, BRCA gene that is so much in the news.
That's right. So there's a gene called the BRCA gene. Often this is a gene that's passed down within the family. Right. Occasionally it can occur spontaneously as well. And this is associated with an increased risk of both breast cancer and ovarian cancer. Okay. And it's something that you can talk to your primary care doctor if that's something that you're concerned about.
What are the risk factors which are specific to Indian women, if there are any?
So there aren't any specific risk factors associated with Indian women, but there is an overall increasing incidence in Southeast Asian women for the development of breast cancer, and the thought is that this is due to environmental factors, a change in diet, increasing obesity. All of these things are thought to have led to the slightly increased incidence that we're seeing.
And do Indian women get breast cancer at an older age as compared to their Western counterparts, or is it about the same age group?
So interestingly, it's actually at a slightly younger age. Okay. The incidence, like I said, has been slightly increasing, but in the non-Southeast Asian population, we see an age of about 60 to 70 as the general age in which women are diagnosed with breast cancer, while in Southeast Asians it's a lot younger. It's actually somewhere between 40 and 50.
What was my experience when I was in India was that breast cancer was picked up at a much more advanced stage at that time.
That's correct.
There's not that much early detection. Now, what are the recommendations for screening?
So there's a couple of different schools of thought on this. Right. The American College of Radiology and the American Cancer Society both recommend that screening begins every year at the age of 40. Right. The reason that they recommend this is that breast cancer is a very preventable or very treatable process when it's diagnosed early. And when a woman is diagnosed at the age of 40 or between the age of 40 and 50, she has a lot of life to live. And I think being diagnosed that early, her treatment can begin very early. And that's one of the reasons why both of those societies recommend starting between the age of 40 and 50. There's a very, very low risk of radiation from a mammogram, and I know some women might be concerned about that and may want to delay starting mammography because of that. the amount of radiation that you get from a mammogram is actually equal to about one flight from here to India.
Oh my goodness.
So it's very,
okay.
very low.
Okay.
So there really isn't a risk of radiation
Okay.
if that is a concern.
Okay.
But we do recommend starting at the age of 40. And especially in the Southeast Asian population where breast cancers are diagnosed at an earlier age, it's more important,
Now,
I think.
there are some schools who also recommend doing a baseline screening at 35. And then after 35, you don't need one if all is well between 35 to 40, right?
That's correct, yeah. And I think that's an option. The reason that we don't want to start too early is women who are very young can have very dense breast tissue,
True.
and that can obscure what we see on a mammogram. It can make it very difficult to read a mammogram. But I think it's reasonable to start at the age of 35, just having one mammogram to see what your breast tissues look like as a
Okay.
baseline.
Women who have a strong family history of breast cancer, are there any recommendations for them to start much earlier?
There are. So depending on what your family history is,
Right.
there is sometimes a recommendation for starting before the age of 40.
Right.
And if you do have a family history, or if you have any kind of genetics that is linked to breast cancer in your family, I would recommend that you talk to your primary care physician, who might be able to refer you to a genetic specialist to let you know whether this might be something that's good for you.
And what are the other options of screening apart from mammogram?
So mammography is the only proven method for breast
Right.
cancer detection. So that's the only one that's recommended to be done annually.
Right.
Other breast imaging methods include breast ultrasound and breast MRI. Breast ultrasound can often detect a lot of different abnormalities that may not be something that's worrisome. And it's hard as a radiologist for us to determine whether what we see on an ultrasound or an MRI is something that's suspicious or not. So it leads to a lot of unnecessary biopsies, and that's why we don't recommend doing only an ultrasound or only an MRI. Those techniques are used in addition to mammography. Mammography can detect very, very small cancers, which some of these other methods may not. But they are other options that are used in addition.
Traditionally, what I've seen in practice is that the younger women often will come and they come with lumps or cystic lesions, then we do start with ultrasound.
That's correct. So in the younger population, especially before the age of 40,
Right.
we often start with just an ultrasound. And that can sometimes give us the answer if you don't have a very high risk, and if you have something that you're feeling, a focal area that you're feeling, then we can often start with ultrasound just to take a look at that, and then proceed to mammography if needed. If you're over the age of 40, we almost always recommend doing a mammogram first,
Okay.
because we can see more
Sure.
abnormalities.
So
there.
tell us about the 3D mammography.
So 3D mammography is a new technique that was developed
Right.
probably about 4 or 5 years ago.
Okay.
Most of the institutions are now adopting it, and it on a 2D mammogram, which is what you get in as a standard mammogram, we have one picture taken of each breast, and it's a 2-dimensional picture. Your breast tissues are overlapping each other on these images, and it sometimes makes it difficult for us to see what's in between all of these
Right.
breast tissues. On a 3D mammogram, we take multiple slices through the breast, and that allows us to see multiple different levels and spread out the breast tissues in a way that lets us see things a little bit better. So it's especially important, especially useful in younger patients and in patients that have very dense
And
breast
how
tissue.
expensive is it?
So most insurance companies have started covering it.
Okay.
That's just as of this year. So I would speak with your insurance provider, and it's
Okay.
something that it's probably covered.
What are the most common signs and symptoms of breast cancer?
So the biggest one is a lump that's being felt. If you feel a lump in your breast, it's definitely not something that should be ignored. Other things that could indicate a breast cancer is nipple discharge, possibly areas of pain. Any kind of symptom that you're having that's focal to your breast is probably something that you should have checked out. It's so easy to get breast cancer screened, such a simple test, that it's always something to get checked out.
And I'm a big fan of breast self-exam. I think every woman should know the feel of her own breast. Now, what is once the diagnosis is made, what are the treatment options for breast cancer?
So there are many different treatment options depending on what type of breast cancer it is, depending on how big it is. It's usually a team of oncologists, breast
Okay.
surgeons, radiation oncologists that all work together to come up with a plan for you. And once you are diagnosed with it, you would meet with each of these specialists who will go over the best treatment option for you.
And the prognosis seems to be getting better with the early diagnosis, right?
That's correct. Yeah, it's a very, very high survival rate. It's a very treatable process if it's diagnosed early. So.
Okay. Now, tell us a little bit about yourself. Tell us about your life.
So
Did you go to school here or in India?
I did. I went to school here. I went to undergraduate school at Tufts University, and I did my MD at the University of Massachusetts in Worcester. I stayed there for my training for residency, and then I did my specialist training in breast imaging at Mass General Hospital. So I'm local. I've been around here.
And
for
you
a
have two
while.
small children, right?
Two young children. Yep, 1-year-old and a 3-year-old.
Oh my
So-
goodness. And I also read that you're associated with a charity called Asha Jyoti. Do you want to tell us about that?
Yeah, so it is part of a bigger organization called RAD-AID, which is an organization of radiologists that travels to different parts of the world to provide services that are not provided in those areas. And the part that I'm involved in is called Asha Jyoti, which is located in Chandigarh in India.
Okay.
And so we go there probably about 3 or 4 times a year, and there's a van that's there that provides
That's
screening to some of the
Wonderful.
small villages in the area.
Wonderful.
And we do biopsies. There are hospitals that are associated with this service, and so patients who are diagnosed with breast cancer can go to these hospitals and get treated free of charge.
That's wonderful. So do you have any message for our audience? All the women who are watching.
Well, as I've mentioned a couple of times, breast cancer is a very treatable process. It's something that you should definitely get checked out, and I would love to see all of you. So.
Okay. And I recommend all of you to come and listen to Dr. Hetal Verma at the Health Expo. And if you have any questions, she will be around after her talk also to give you some guidance. Thank you. Thank you, Hetal.
Thank
you so
you.
much for coming.
All right, thank you.
Menopause can be the most life-changing experience in a woman's life. It can be very simple or very complicated with multiple health issues. Let's meet our expert today, Dr. Tara Singh. Tara, welcome to the show.
Thank you for having me.
Tell us something about menopause. What is menopause? What is perimenopause?
So menopause is the time when the hormone levels change in a woman's
Right.
life. And due to the change in the hormone levels,
Mhm.
a woman is no longer fertile or can't have babies and stops having her periods.
Right.
The perimenopause is the time leading up to this.
Mhm.
So in that time frame, women may notice that their periods space out a little bit.
Mhm.
Sometimes they're a little bit closer together. They get
Mhm.
shorter.
Right.
And then women start to go time and again without periods and eventually hit menopause, which is defined clinically as 12 months without a period.
Now, what is perimenopause?
So perimenopause is the build up to that, and it can be
Right.
several months, it can be years, even in
Mhm.
build up. Women sometimes experience significant mood changes at the
Right.
time, maybe a little bit more teary, a little bit more irritable.
Right.
We all have that at some time in our
Yes.
lives. Women also may notice that they have some hot flushes, meaning
Right.
that they all of a
Right.
sudden, for no perceived reason, feel very
Mhm.
hot.
Right.
And women may also notice that their desire to be intimate, the desire for the relationships may change as well.
Right. Do you think perimenopause in some ways is harder because the levels of the hormones change frequently?
I do, yes. I think that in some ways the hot flushes can be more
Mhm.
severe in the perimenopausal period. It's like your body is trying to combat the hormone changes that are occurring, and so symptoms may seem more severe. I feel also sometimes patients don't realize perimenopause is
Right.
coming on because
Right.
it's coming on in the 40s, and some of them think this is too early for me to be having these symptoms.
So what's the typical age of menopause in this country?
So in the North American Society, the age of menopause is 51.
Okay. And what about the Indian counterparts?
It's slightly earlier. So in the
Okay.
Indian population, the average age of menopause is 48 years old.
Okay. Now, there used to be an old saying that early menarche is associated with late menopause. Is that true?
No, not necessarily. It may be, but it hasn't proven to be
Yeah,
absolutely
okay.
true.
What are some of the most severe symptoms of menopause that you see in the practice?
So I think the time of menopause can
Right.
unfold severe hot flushes, which can be detrimental for a woman. They can
Mhm.
keep her awake at night so she's not
Mhm.
sleeping well.
Right.
And they can interfere with her daily activities, making
Mhm.
women sometimes embarrassed to go out even in public. I think also the mood changes can be detrimental to a woman as well.
Not just for the woman, I think, can be for the family also,
Family
right?
too. But some women do, it may unmask for the first time depression in a woman's
Right.
life. And I think at that point, if the symptoms are severe, either the family of the patient or the
Right.
woman herself need to approach a doctor to help with that.
Right. Now, what is the treatment for menopause?
So there are lots of different options for treatment. There are lifestyle changes that can help.
Right.
And there are also medical treatments. Some of the lifestyle changes that we recommend to our patients include exercise, decreasing caffeine and alcohol intake, stopping smoking. That's something that you do. And even meditation and yoga can be very helpful, learning breathing techniques to help deal with some of the hot flushes. In terms of medications, there are herbal medications, things like black cohosh, you might have heard about.
Does that work or?
It works probably 50% of the time, so it doesn't work for everyone, and it's mostly to treat hot flushes.
Right.
And then there's hormonal therapy as well. Hormone replacement therapy is what it's been called in the past. And that's a combination of replacing the hormones that are changing, the estrogen and the progesterone that a woman normally has in her body.
There's so many controversies about the hormone replacement therapy. What are some of the newer guidelines for hormone replacement?
So I think the big women's health initiative that came out
Right.
several years ago really said that women shouldn't be on hormone replacement therapy because there were risks associated with it. As you know, with any medication that you take, there are risks associated. And part of the Women's Health Initiative, or the WHI, results were because every woman was treated, regardless of whether they had symptoms.
Right.
So now most of the menopause societies in the world have said it's okay to take hormone replacement therapy to treat particular symptoms.
Right.
And some of those symptoms might be hot flushes. Some of them might be changes in the vaginal architecture and vaginal dryness that may impede sexual intimacy.
Right. Now, what about the bioidentical hormones? There's so many people selling even or talking about these bioidentical hormones. What is your take on that?
So I think you have to be very careful with bioidentical hormones. There's a lot of stuff out there, and there's not a lot of good studies looking at whether it's safe or not to take bioidentical hormones. I think if it's something you're really interested in, it's a good idea to talk to your physician about it. And I think you need to be careful about buying off-label products in the stores without at least asking a physician whether the dose seems correct or something that you should be taking.
Now, with the hormones also, typically, which are the, you give patients both, if they have a uterus, then you give them estrogen as well as progesterone.
That's
right?
correct, yes, yeah.
Right.
Giving estrogen and progesterone is the best way to protect a woman from having any other complications like cancer of the uterus when you have a uterus.
What about the newest product where you have estrogen with also SERM kind of products? Are they very popular?
Not yet. They haven't. They're just starting to come out and become
Right.
more
I think
popular. But
Duavi is
I
one
have to
of
say, a
them,
lot of
right?
patients haven't asked about them yet.
Okay. And what about the local products that you can use for Replens, for example? I think they're local products just to make women more comfortable as well, right?
Well, I think Replens is wonderful. It has no medication in it. I think it's safe for women to understand how to use that.
Okay.
And I actually recommend it to all my women who are going through menopause who want to be more comfortable.
Okay. Now, what about depression? Does hormone replacement help with depression, or you recommend antidepressants for them?
Hormone replacement therapy alone will not help with depression symptoms.
Right.
Really, I think it's so important to have a good physician
Right.
or a psychiatrist, somebody you can talk to about what you're dealing with. Even family members can be very helpful in this realm.
Right.
And then usually antidepressant medication is the best way to treat it.
I think it's so important for menopause to be understood and the symptoms not just by the woman but also by the family, because you need, that is one time you need a lot of support.
Yes.
And I think it's so important for men to be educated about menopause as well.
Absolutely.
Now, there are certain antidepressants which are thought to be more helpful for menopause, for example, Effexor. Do you find that in your experience as well?
Yes.
Okay.
Yes. Effexor is one that I've seen used more commonly for depression
Okay.
at the time of menopause.
How about over-the-counter products like St. John's wort?
Again, they have limited studies available
Okay.
looking at efficacy, and it really, most of the studies suggest that there's not much of an effect. Again, for the odd
Okay.
patient, it might work.
Okay. And insomnia is another symptom that we see a lot in women. What do you recommend for that?
So good exercise can actually help with that. And again, meditation and yoga that we talked
Right.
about. Dressing, where I worked previously, they had these pajamas called mama pajamas. And they
Really?
were made of a
I've never seen
material
Okay.
specifically for
Okay.
menopausal women so that when
Really?
you're sweating through the night,
Okay.
You don't retain the
I
heat.
haven't heard of those. They're
Something
called
new.
mama pajamas?
Mama pajamas. Valerian is something that has been shown to help with sleep
Okay.
at night, so that is an option. And then if it's really significant and severe, hormone replacement therapy is something you talk to a provider about.
Okay. How about melatonin?
Not particularly
Not
in the menopausal
particularly.
woman.
So one of the big concern has been if there is increased risk of heart disease or breast cancer with hormone replacement therapy. What are your thoughts on that?
So the Women's Health Initiative study, or the WHI study, looked at both of these issues, and they compared women across arms, women who were on estrogen and progesterone because they had a uterus still,
Right.
and women who were just on
Right.
estrogen because they had no uterus.
Right.
With regards to breast cancer, what they found was it was the women who were receiving progesterone that were probably at higher risk.
Right.
But that risk typically increases after 5 years of use. So when you're seeing women who are on hormone therapy beyond 5 years, you have to evaluate whether it's really worth it for them to continue on hormone therapy at that point or not. In terms of heart disease, one of the problems with Women's Health Initiative is the average age of women was significantly older, in their 60s, when starting hormone therapy. And it was given to every woman, regardless of symptoms or not.
Right.
Most of us gynecologists would recommend that a woman in her 60s probably does not need hormone therapy, and would consider discussing discontinuing hormone therapy, as we're not entirely sure if the risks of heart disease continuing into that age range.
Is there some truth in the fact that if you start the hormone replacement therapy within 1 year of menopause, then you get the maximum benefits?
That's the closer you are to menopause, the more beneficial the hormone therapy is expected to be.
And how about the younger women who start, who have a hysterectomy for whatever reason, and they go on hormone replacement? What are the risks they can suffer because of hormone replacement therapy for too long?
So again, if we remove a uterus in a woman and ovaries in the early 40s, we
Right.
do actually recommend that they stay on hormone replacement until the age of natural menopause, which in North America is about 51, and in the Indian population about 48. And the reason for this is the bone protection that the hormone therapy actually provides. Because as we know, as women get older, once we don't have that estrogen circulating in our body anymore, we're at increased risk for bone disease. And again, that's why it's so important in older women to consider calcium and vitamin D supplementation.
Absolutely. Do you have any message for women who are suffering from menopause? And for men who should support them?
I think for women who are suffering from menopause or worried that they may be suffering from menopause, it's so important to reach out to family members to make them aware of how you're feeling and how they can help you. I think for men, just to be a support for the woman in your life who is dealing with this, and just that she knows that you're there to support her. And women, please see your physicians as well. In the time of menopause, we have to be so careful about bone health, taking calcium, vitamin D, regular exercise. So reach out to your physician to help with that and any other symptoms that you might be having.
So just so there is hope, how long do the symptoms of menopause last?
Well, I hate to say this, anywhere from 2 to 8 years.
Because sometimes I'll have patients in their 70s who say, I still get my hot flashes.
Yes,
So,
yeah, it can go on that long, unfortunately.
Typically 2 to 8 years.
That's right, on average.
Okay, so before you go, tell us something about your life.
So I'm actually Canadian trained and moved to the United States about 6 years ago with my family. I have an interest in women's health and have spent some time abroad as well. I've actually worked in India at the All India Medical Institute of Medical
Wonderful.
Sciences, doing some work on sexual health and women's understanding of sexual health.
We look forward to hearing you at the Health Expo. And if any of you have any questions that you would like to address to Dr. Tara Singh, come to her talk, and she will stay behind to talk to you as well. Thank you so much. Thank you so much for coming.
Thank you.
Thanks. 79 million Americans are infected with HPV virus or human papilloma virus, which is the biggest risk factor for genital warts and cervical cancer. 14 million Americans get infected every year. We're going to talk to our expert, Dr. Manasa Patna. Welcome to the show.
Thank you so much.
Thank you. So tell us about this HPV virus
Sure.
and the vaccine.
Great. So as you just pointed out, HPV, human papillomavirus, is the most common virus associated
Okay.
with cervical cancer and genital warts. There are many different strains of the virus. HPV 16 and 18
Right.
account for about 70% of all cases of cervical cancer, and HPV 16 in particular is more closely associated, and it's highly prevalent. About 80% of all sexually active women actually come in contact with the virus, and so it's sexually transmitted virus and very common among a sexually active female population.
Right. So tell us about this HPV vaccine.
So the HPV vaccine there's two kinds.
Right.
They cover both HPV 16 and 18, the two
Mhm.
strains of HPV most commonly
Mhm.
associated with cervical cancer and warts. And the vaccine is relatively new, and
Mhm.
it's covered by insurance. It
Mhm.
is a 3-shot
Mhm.
cycle, so you need 3 doses
Right.
to have complete protection.
Mhm.
We offer it now for women age 9 through 26. They're especially targeting
Mhm.
girls ages 11 and 12, but
Mhm.
important to understand that boys should be vaccinated as well
Absolutely.
for
Absolutely.
protection against transmission, as well as having genital warts. So I think we've been slower to vaccinate boys in this country, but we're working on rolling out the
Okay.
vaccine in schools
Okay.
for girls.
What are some of the adverse effects of this vaccine?
It's very well tolerated. There
Mhm.
actually aren't very many side effects,
Mhm.
and I think a lot of people think that
Mhm.
by rolling out the vaccine, you're encouraging sexual activity
Right.
in schools, and that should be the wrong message.
Mhm.
It's a very safe virus and very well tolerated.
Okay.
And
Now,
it's a very safe vaccine.
right,
Sorry.
right. So, do you think that there is more resistance to this vaccine from the Indian population? Because I have seen that in practice, that Indian parents generally want their kids to be vaccinated only after they're 18. Do you see that as well?
I haven't personally seen that in
Mhm.
my clinical practice,
Right.
but I take care of older women, so
Okay.
I can see how
Mhm.
families would be
Mhm.
concerned that by
Mhm.
giving their young
Mhm.
daughters
Right.
this vaccine against a virus
Mhm.
that's a sexually transmitted
Mhm.
disease, there might be some concern that they're addressing sexual
Okay.
activity.
So that brings me to the next question. How do we diagnose the HPV, that you're infected with HPV virus? Goes with the pap smear as well. So tell us a little bit about what is the pap smear, what should be the frequency of testing?
Sure. So the pap smear screening guidelines have recently changed,
Right.
and I think that's something that I think a lot of people are still
Mhm.
trying to wrap their heads around about the
Right,
frequency
right.
of screening. But we don't recommend screening for your first pap smear until you're 21,
Mhm.
and we don't actually recommend testing for HPV in girls younger than age 30, just
Mhm.
because the chance that you could have the
Mhm.
HPV virus is
Mhm.
so common. Like I said, about 80% of sexually active women have it, and
Right.
the time to
Mhm.
clear the virus is
Mhm.
about 8 months to 2 years
Mhm.
in most young women. So
Mhm.
even if you do get it,
Mhm.
the fact that your body will clear it on its own is so high,
Right.
and testing for it and being positive for it in young women
Mhm.
usually raises more concern, because
Mhm.
people are worried that they then now have
Mhm.
this virus. So
Mhm.
we recommend testing for pap smear starting at age 21.
What about women who are sexually active? Should they not start at earlier age, pap smear?
No, so the guidelines now are to start everyone at age 21, regardless
Okay.
of age of first sexual activity.
Okay.
And for all women, the screening now is every 3 years for pap smear,
Mhm.
and not to test women younger than age 30 for HPV.
virus, right?
For women older than age 30, the screening of pap smears is still every 3 years, but
Mhm.
we do recommend co-testing the pap and the HPV test in women over 30.
Right.
And if they are negative for both the pap smear and the HPV, they
Mhm.
can move to an interval of every 5 years for screening.
5 years now.
Mhm.
It used to be 3 years,
Yeah,
right?
so
Now
if
it's
you're
changed.
now negative for both the pap smear and the HPV virus, the chance that you could
Right.
develop abnormal cells is so low that it's moved to every 5 years.
And it's a slow-growing virus as well, right?
Mhm.
So women or anybody who tests positive for HPV virus, does it mean that they have genital warts? Are they more prone to genital warts? What does that mean when you're positive for HPV virus?
That's a great question. It means you have the HP virus, and you could have any number of the strains.
Right.
There's about 40 different kinds.
Right.
We now have the ability to test for the HPV 16 and
16,
18,
right.
the high-risk
Right.
HPV. If you
Mhm.
have the high-risk HPV, you are at higher risk for developing abnormal cellular changes in your cervix that could, down the line, lead to a cervical cancer. But it's on the order of 7 to 10 years before you could see
Okay.
those
Okay.
those changes.
So for a woman who has a normal pap smear but is positive for HPV, what are your recommendations? Because as primary care doctors, you often, when you do, you get the results positive HPV but normal pap smear. What do you recommend?
So if you have a normal pap smear and positive HPV, you have a few options.
Right.
You could just repeat the pap smear and the HPV test in a year, and based on that, you could decide what further testing needs to be done.
Okay.
You could test specifically for high-risk HPV 16 or
16
18.
and 18.
And if there is the presence of the high-risk strain, then you would consider the next step in evaluation, which is something called colposcopy.
Which brings me to the next question about cervical cancer. They right now the studies show that about 12,900 women will be diagnosed with cervical cancer, and about 4,000 women will die of cervical cancer every year in United States. And HPV virus is the commonest risk factor for cervical cancer. So tell us some of the other risk factors for cervical cancer.
So being infected with the HPV virus is the biggest risk factor.
Right.
The other risk factors are a number of sexual partners, which makes sense. The more sexual partners you have, the
risks.
more chance you
Right.
could come in contact with the high-risk strain. Smoking is a big risk
Yes.
factor, and being immunocompromised. So
Sure.
for any reason you are on drugs that, or you have other illnesses that require you to take medications
Right.
that suppress your
Right.
immune system,
Right.
or if you are HIV positive, or infected with other sexually transmitted diseases, your risk of contracting a higher strain of HPV and developing abnormal cervical changes is higher.
And what are some of the signs and symptoms of cervical cancer?
Most commonly, women will present with abnormal bleeding patterns,
Right.
Especially bleeding after intercourse.
Mm-hmm.
If you're diagnosed with a later stage cervical cancer, you may notice that you have pelvic pain,
Right.
issues
Right.
with your bladder, moving your bladder,
Right.
urinating, changes in your bowel movements.
Mm-hmm.
But pretty much the early stages are changes in menstrual flow and bleeding after intercourse.
And how do you diagnose it?
So very important to keep up with your screening.
Right.
If the benefit of cervical cancer is there's very effective screening. If your pap smear comes back abnormal, then you undergo something called colposcopy,
Right.
which happens in your gynecologist's office, where we look at your cervix very closely under a microscope. And that allows us to look for specific changes and perform biopsy. So where we actually take a piece of the tissue in the cervix and look at that under a microscope to see if there are changes in the cells of the cervix that look either precancerous or cancerous. And based on what those are, we make further recommendations.
And what is, in general, the treatment of cervical cancer?
So if we do the colposcopy and you're diagnosed with a precancer, the treatment usually is something called a LEAP procedure, where
Okay.
we remove the top layer of the cervix where the cells are most likely to become abnormal, and then you're sort of followed with screening pap smears. If you are diagnosed with an actual cancer, then you become referred to a specialist, a gynecologic oncologist, and then depending on the stage of the cervical cancer, you may undergo radiation, chemotherapy, or surgery.
Okay. And what is the prognosis?
So depending again
The
on
stage
what
of the-
stage
right,
there
for all
for
cancers,
most
right.
for
Right.
most advanced cervical cancer, the prognosis is poorer. For early stage, there is great prognosis, especially if it can be surgically removed and you can follow with appropriate screening.
Okay. Now that brings me to the next topic, which is ovarian cancer. Ovarian cancer is considered the 5th leading cause of death from cancer in women. So tell us something about the signs and symptoms of ovarian cancer.
So ovarian cancer, unlike cervical cancer, is much more difficult because there is no effective screening, and often women present with symptoms that are very late stage in the diagnosis. So symptoms of ovarian cancer can include pain, feeling bloated, noticing that your pants don't fit quite as well as they used to. nausea, vomiting, decreased appetite,
Right.
weight loss.
Is it true that ovarian cancer is still diagnosed when it is metastatic?
Usually usually women present after they're symptomatic or someone has felt a mass, and in that case, you're looking at a very advanced
Right.
case of ovarian cancer, and so
Because the
unfortunately, it is
Right.
still
It's
diagnosed
still the
late.
ovarian, what I find, the symptoms of ovarian cancer are still so non-specific. That's the hardest part, right?
Yes.
Now, how do you treat ovarian cancer?
So ovarian cancer is, depending on what
Right.
stage it is treated primarily surgically, and then with chemotherapy, with multiple rounds of chemotherapy. If it is in the very most advanced stage, some people will still offer surgery for symptomatic relief, but the chemotherapy in that case will be what we call palliative, where there's no
Right.
cure, but more for
Right.
symptoms.
Right. So, what is your message for our audience?
So gynecologic cancers are very, very common, and so it would recommend everyone to stay on top of their primary screening, especially for cervical cancer, where we have effective screening. You can essentially ensure for yourself that that is a disease you never have to worry about, and make sure you vaccinate your young children. And for ovarian cancer, also continue with your annual gynecologic exams, and pay attention to anything that you're concerned about symptomatically.
And before you go, tell us something about your life.
I'm very interested in global women's health, and I've
Okay.
worked in India, more in southern India,
Okay.
with cervical cancer screening, contraceptive prevalence, and improving maternal mortality, actually, because a lot of women there still are not giving birth in the hospital, and they have complications from that as well. So
Wonderful. And we look forward to your talk at the expo.
Right.
And Dr. Manasa Patna will be there, and she will stay back and talk to you if you have any questions. Thank you. Thank you so much.
thank
for
you.
coming.